Vibrio cholera is the causative agent responsible for cholera. It is characterized by severe diarrhea and dehydration, which can lead to death in less than 48 hours if untreated. The CDC said that cholera bacterium is usually found in water or food source that have been contaminated by feces from an affected person with cholera. The CDC stated that it can take from a few hours to 5 days for symptoms to appear after infection. Symptoms typically appear in 2 to 3 days, and people who are at greater risk for cholera are the ones who live in places with inadequate water treatment, poor sanitation, and inadequate hygiene.
The cholera outbreak occurred in October 2010, confirmed by the Ministry of Public Health and Population. The cholera outbreak started in the Rural Center Department, located north of Port-au-Prince, the capital. The first case of cholera was from the town of Mirabelais. The exposed population was everyone near and in contact with the Layton and Artibonite rivers. The mechanism of exposure was drinking water and sewage treatment that were contaminated by cholera. Ivers et al. Conducted a study with the first case of cholera in Haiti. This individual was a 28-year-old man from the town of Maribelais, which was crossed by the Layton River. At home, water was clean and portable, but because of his mental illness, this individual would go every day to bathe and drink water from the Layton River, which was contaminated by the cholera bacterium. It started first in Meli, then quickly spread to the Artibonite town of St. Mark, and then to all of Haiti's 10 departments and provinces by the first 10 weeks of the epidemic. It spread so fast because of the logistical issues such as poor water sanitation.
According to the CDC, the Haitian cholera outbreak was one of the best coordinated and documented responses to a cholera outbreak in modern public health. The coordination was led by the MPHP and the U.S. government, principally through the CDC. The CDC responded to the outbreak through its Emergency Operations Center, based in Atlanta, Georgia. Following the outbreak, CDC experts were deployed to Haiti and the Dominican Republic to provide in-country assistance. Surprisingly, the Division of Global HIV and AIDS, based in Haiti, also played an important role in the coordination of the response. Once in the country, CDC experts, along with the MPHP, established a national surveillance system called the National Cholera Surveillance System, NCSS, to track cases of the disease. According to Barzilay et al., the NCSS was composed of both governmental and non-governmental health facilities. The MPHP and the CDC then developed a cholera treatment and prevention plan and trained 10,000 healthcare workers across the country. These community health workers were important in the fight against cholera because they provided healthcare services and education at the country level, particularly in rural areas. They also helped leverage in-country resources such as the President's Emergency Plan for AIDS Relief and non-governmental organizations in order to increase the number of cholera treatment centers and oral rehydration points.
There were two hypotheses about the introduction of cholera in Haiti: the climactic hypothesis and the human transmission hypothesis. The first hypothesis argued that in the beginning, Vibrio cholera was not pathogenic, but changes in the environment made it evolve into a pathogenic strain. The second hypothesis suggested that cholera was brought to Haiti by people of another country, Nepal. In 2016, the UN finally admitted to its role in the cholera outbreak, saying that the source of the disease was a UN peacekeeping camp. According to an article written by Camilla Dominowski, activists sued the UN over the cholera outbreak in 2013, but it was dismissed because the international treaties immunized the UN from
The coordinated efforts of the MPHP and CDC helped reduce the mortality rate from nearly 4% of all cases to less than 1%, saving approximately 7,000 lives. The MPHP and CDC developed 5 immediate priorities in order to contain the spread of cholera. These priorities were: drink and use safe water, wash your hands often with soap and safe water, use latrines or bury your feces, do not defecate in any body of water, cook food well, keep it covered, eat it hot, and peel fruits and vegetables. Clean up safely in the kitchen and in places where the family baths and washes clothes. Due to this outbreak, Haiti improved the water, sanitation, and hygiene throughout the country. In addition, in order to prevent the outbreak to become endemic in Hispaniola and spreading throughout the region, the country established a systemic cholera surveillance. This strategy has allowed experts to target the use of oral cholera vaccine, but also made the international community more concerned about the issue. In order for the cholera surveillance to be successful in the future, Haiti decided to operate at the commune department and central levels, according to Orada et al. Cholera is an infectious disease that can be controlled and cured very easily. It is highly contagious and can spread very rapidly. Although a lot of countries successfully eradicated it, others did not. Unfortunately, those who did not are the developing country, mostly in Asia, Africa, and Latin America. The World Health Organization calls for the cooperation of all different sectors of the society in order to limit the effect of cholera on populations. According to a study conducted in Kariga et al. And entitled Economic Burden of Cholera in the WHO African region, there is an economic cost associated with cholera. The main driver of costs of cholera in the study was due to premature deaths of young children. This is the reason for why we need to eradicate this infectious disease in the affected countries by improving their sanitation systems. This would definitely help allocate money towards other sectors, such as education and road infrastructure.